हेलो सर, टेक सपोर्ट से बोल रहा हूँ।
सर सर आप देख लीजिए अगर स्क्रीन आ रहा है कि नहीं सर, देखेंगे सर आप। नहीं सर नहीं आ रहा, वही पूछ रहे हैं सर। फोन लगे। अच्छा कहाँ गया, बाहर गया क्या? उसको बोलिए फोन देने के लिए, क्या है कि उसका फोन से सर का अटैच कीजिए। তোর ফোন দিয়ে নেট স্যার অন করা আছে না? হ্যাঁ তো ফোনটা লাগো, অসুবিধা নেই তো। হ্যাঁ 12টা ঠিক করো सर। आपका तो निकल गया है, आपका बाहर हो गया। এই স্যারটা বাইরে হয়ে গেছে, স্যারটা আউট হয়ে গেছে, স্যারটা লগইন কর। প্লেয়ার খালি কেউ বুঝলো, ঠিক আছে? তোর ফোন দিয়ে করা তো, স্যারটা আউট হয়ে গেছে, লগ আউট হয়ে গেছে। হুম দেখ আবার নতুন করে। হুম হুম মেল থেকে আগে ওটা খুলে দে, আগে পিপিটিটা খুলে দিয়ে তারপর জুমটা লগইন কর।
শেয়ার করতে হবে, এখান থেকে শেয়ারিং স্ক্রিন শেয়ার করতে হবে। স্টার্ট হচ্ছে না আবার করতে হবে, হচ্ছে এক্ষুনি করছে, এক্ষুনি স্টার্ট হচ্ছে, হয়ে গেছে বড় স্যারকে এবার আমি লাইভ করে দিচ্ছি এখান থেকে। স্যার এটা চলে এসেছে, ঠিক আছে স্যার? হ্যাঁ এখানে আসছে।
जी हेलो टेक सपोर्ट।
जी बोलिए सर।
हाँ सर आप देखिए तो सर आ रहा है क्या, स्क्रीन आ रहा है?
या स्क्रीन आ रहा है लेकिन ब्लैंक आ रहा है। डॉक्टर कपूर जी का स्क्रीन आ रहा है।
उसको स्क्रीन को शेयर कर दिए हैं, वो आ रहा है कि नहीं?
नहीं वो नहीं आ रहा है। उनका वीडियो कॉल है।
आप देखिए आ रहा है कि नहीं?
हाँ अब आ रहा है, अब आ रहा है।
अब आ रहा है, अब क्या स्टार्ट कर सकते हैं?
हाँ स्टार्ट कर दिए।
ठीक है तो आप इसको लाइव कर सकते हैं सर। हाँ
ओके। यस सर मैं टेक सपोर्ट से बोल रहा हूँ। यस स्टार्ट, लाइव स्ट्रीम स्टार्ट
करते हैं। वेरी गुड इवनिंग डॉक्टर। To all eminent doctors, thank you so much for joining us for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an initiative from Cadila Pharma through the innovation to serve the society and humankind. Topic of the webinar is dosage reduction strategy in rabies management, role of novel vaccine. Dear doctors, rabies is the world's first novel 3-dose anti-rabies vaccine, and with great pride, we would like to inform you that rabies has successfully completed 1 year of launch, with more than 40,000 animal bite victims being vaccinated, and 100% compliance was recorded, and no case of adverse was registered. So this is a very good news for all of us. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. Deepak Kapoor. He is a senior consultant in Howrah, and he is attached with ILS Hospital, and he also attached with senior practitioner in CMRI. He is practicing since more than 35 years and very renowned in Howrah area. So now I would like to request our doctor, Dr. Deepak Kapoor, to initiate the talk, and later on we will have a question and answer session. All the participants can drop their questions in the drop box. We'll read it out and we'll answer the after presentation. Thank you. Doctor, please.
Good afternoon, everybody. And thank you, Cadila, for giving me the opportunity to connect with so many people and to raise awareness regarding the dose reduction strategy in rabies vaccine. My topic of discussion is dose reduction strategy in treatment of rabies.
Hello. Yes, sir, you're on.
Yes. Right.
Yes, sir. I can see your slide.
Yes, I can see your slide.
Right, I can see my slide.
स्लाइड ये अब आ जाएगा सर.
Okay, that's great.
Okay, sir.
And the topic of discussion is rabies disease and animal bites incidents and all these things. This is the structure of rabies virus. It's a very deadly virus and is the cause of the rabies disease, which is passed from the animals to animals and animals to human being also. This virus contains many protein. As we all know that rabies is a zoonotic disease and is caused by rabies virus. This virus is encoded by 5 structural proteins, as you can see in the picture, and very soon it will be elaborated. There are various types of protein like N protein, M protein, P protein, L protein, and RNA also, and the most commonly G protein, which is present outside of the virus. G protein is the major antigen in the formation of neutralizing antibodies against rabies. The incidence of rabies is causes 59,000 deaths globally per year, and in India it's no less. It's almost 1/3. You can say that 20,000 rabies deaths per year. And the most irony of the whole thing is 91% deaths occurs in rural area. So we can know the importance of awareness in case of rabies treatments. And the most important thing about rabies is that rabies is a disease which is 100% fatal. Till date, there is no satisfactory treatment available in the market of rabies. But it is 100% vaccine for preventable disease. So if we can provide vaccines to the affected people at time, and the people get awareness to get it on the time, then it's 100% preventable disease. Now, evolution of rabies vaccine. Rabies is a very old disease, age-old disease, And from 1885, there was live attenuated vaccination available, which used to be given in the spinal cord. It was, and you will be surprised note that there was up to 31 injections were required to give, and you can well imagine how much painful it would have been for the people who were suffering from rabies. But after 1911, the inactivated vaccines were available. These were given brain, and this was in our childhood. The people used to get this vaccine. There was 14 injection used to be given. We all know it was used to be given in the subcutaneous area, and each dose used to be 0.5 ml per day for 14 consecutive days, and it was really painful and used to be having so many side effects also. But after 1976, the whole scenario changed, and the cell culture vaccine were available. They are inactivated vaccines, and they are standardized immunogenicity, and they are lyophilized. Now they were available at 5 injections. Till date, before the invention of, availability of TH rabies, they were available, and the schedule was 5 injections of them at the schedule of 0, 3, 7, 14, and 28. But with this challenge, this injection, the current challenge was the compliance of the patient. Current rabies vaccines are cell culture vaccines, and they are inactivated vaccines and are almost 50 years old technology. I told you it was available from 1976, but it's almost 50 years old, and there are inconsistencies potential. The problem is the stability, short supply, and adverse effect. And more thing are due to number of 5 doses, there was decreased compliance beyond 3 injections. People never used to take beyond. They used to take, though it was quite less than the 40 numbers of injections people used to have taken before, but now people don't want to take even more than 3 injections. That is the main problem with this. Now our challenges was to reduce the number of the doses so that we can increase the compliance, because the course is not completed, it's useless to take any single vaccine or any vaccines. Here you can see the compliance is a major issue. After the chart is showing after 4 injections and after 5 injections. You can see, after 5 injections, the compliance was very much less than this. So it was our challenge to reduce the number of doses for the rabies treatment. This was the meeting the unmet medical need to introduce a novel vaccine which have simple and which have a shorter regimen, so then patient taken, because nowadays most of the patients are very busy. They cannot wait for many days to take someone has had to go outside, out of station, someone has got some other problems. So it's really a problem. Since I am dealing with rabies patient, I know that after 3 or 4 days, they tend to say, sir, isse nahi ho jayega, dada ethi ke hobe na, etai aro beshi nite hobe. That was the whole thing. So now the Cadila company has called recombinant rabies G protein vaccine, and they are marketing in the name of rabies. This is first protein subunit vaccines, and this is prepared by VLP platform technology. VLP stands for viral-like particle. First vaccine, it is the first vaccine with 3 dose intramuscular regime, and the regime is 0, 3, and 7 days. And the course stops within 7 days. 0 being the date of first injection. It is leading to better compliance due to easy to follow the regimen and less visits. Since the number of doses is less, the pain is less, and the patient can complete within a week the whole treatment. And it is very convenient, ready to use, and there is no reconstitution needed because it comes in a pre-filled form. And now we are coming to the VLP technology. This is the native virus. G protein is difficult to stabilize. G protein isolation is using VLP technology. That I told you, this is viral-like particle, and this is purified and stabilized by Cadila Pharmaceuticals. These virus-like particles are protein complexes known as which are existing as nanoparticles. Virus-like particles are similar to native virus particles, but the difference is they don't contain the viral genome. So that's why they cannot replicate. That's a major technological breakthrough, that we can copy the same structure, but due to lack of genome, these particles cannot replicate. Since they cannot replicate but can mimic the viral authenticity without being pathogenic, so we can use them as for the treatment of, prevention of rabies. They are capable of inducing a strong humoral and cellular immune response, and that's why they can be used as, this VLP can be used as vaccines. VLT technology was published in Applied Journal, the referred and most respected magazine in India regarding the treatment and management of, prevention, management, whole thing of rabies. And it was published in April 2021, volume 22, issue 1. It was the whole study. It was written by Dr. Sumit Pradar, this eminent physician in Calcutta, Dr. Ashok Agarwal, Dr. Amit Soni, and Dr. Seema Sharma. It is clinical phase 2 trial. The study was designed with comparing this Thravis with Rabipur. Initially, it was designed that the 10 microgram of Thravis. It was given 2 doses on 0 to 3 days, then 50 milligram Thravis for 0 to 3 days. Then the second, it was considered 10 microgram 0.37 3 doses, and then 50 microgram 0.37 3 doses. Like two were 10 microgram for 3 days, 50 microgram 3 days, 10 microgram 3 days, 3 doses, and 50 microgram for 3 doses. And you can see the seroprotection data. On day 14, 10 microgram was sufficiently providing the protection. Day 42 also, but you can see the changes coming from day 180. And day 220, it was quite evident. The only 50 microgram is the most potent. It is much more than the Rabipur, which is the standard differing vaccine in this case. It was compared with the Thravis, and the reference vaccine was Rabipur. We can see after 270 days, this seroprotection is more than Rabipur also. Now the clinical study, phase 3. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies vaccine administered as simulated post-exposure immunization, a randomized comparative controlled multicenter phase 3 clinical study. You can see that it was done at 8 centers. I'm not going to the details. It was in a pan-India basis on 8 centers. To evaluate the immunogenicity and safety of rabies B protein vaccine administered as simulated post-exposure immunization in healthy volunteers. It was a randomized, comparative, controlled, multicentric study. The total number of subjects were 800, and randomization was done at 2:1 ratio. Like 533 subjects were subjected to Thravis, and 267 patients were given Rabipur, which was used as a reference vaccine. And this Thravis was given as scheduled 0.37 days, while this Rabipur was given 0.37 14/28. This is the usual dose we are using till date for Rabipur. Study design and objective: to demonstrate non-inferiority of the test vaccine to the comparator vaccine. Sorry. Primary objective of subjects were subjects with seroprotection at 14 days post first dose. Seroprotection RVN titer equal to or more than 0.5 units per ml. Secondary objective was to subject with seroprotection at day 42 post first dose of test vaccine, safety by monitoring subjects with adverse events. Seroprotection, the protection obtained by vaccination. Now the results. The results were consistent across different age groups and genders. Observed difference 1.52 with the pre-specified margin of -4%. Non-inferiority of for seroprotection, primary endpoint day 14 and 42 were made. Test and comparator are identical in seroprotection rate, both on day 14 and 42. The efficacy, the seroprotection was seen that on day 14, this Thravis was given 99.24% protection, and this reference, Rabipur vaccine was given 97.72%, but the margin is almost insignificant, you can say. And on the 42nd day, the Thravis was given 98.69, and this Rabipur was given 100%. Again, the margin is not very much; it is almost insignificant. And now the adverse effect. The number of adverse effect. This with rabies, the number was 9.9. Sorry, it was 9.9, and with Rabipur it was 17.2. And local adverse effect means localized pain was, again you can see everything is more with Rabipur, localized pain, redness, swelling, everything. And I mean systemic adverse effect, you can see systemic fever, ear pain, headache, urticaria. Urticaria was less with Rabipur. And this joint pain and nausea, everything except urticaria, everything was more, but not very much. See, 0.19%, 0.19%. Almost this, only fever was a bit high with Rabipur, that is 1.50, 50%. Study conclusion. Thravis was non-inferior to reference vaccine. This was the main important thing, that the Thravis was non-inferior to reference vaccine. It was less adverse effect compared to reference vaccine. And it is the most important thing is, which is very much useful for the general public, is that novel 3-dose vaccine was found to be safe and immunologic, and was compared to 5 doses of WHO pre-qualified vaccine with only 3 doses given to the patient. For this Cadila has got certain awards also. These are given there. Thank you. Thank you very much.
Sir, success story of
Thank you very much, doctor.
Yes. And I have used also for my professional experience. I have used Thravis in last 6 months. I am getting sufficient good result. Till date, I have not encountered any adverse effect till now. And this is very useful, and patient are very happy that because they have to take only 3 injections. Though the cost is a bit high comparing to say Rabipur, but I mean overall the patients are happy because there are less number of pricks, less number of visits, and less pain.
Thank you, doctor. Thank you for your informative talk. We truly appreciate your efforts. Doctor, just 2 or 3 questions we have, sir, because the doctors are live now. So, what are the signs and symptoms of rabies in human?
Signs and symptoms of rabies. The first symptom is this is the patient will be initially the symptoms does not appear initially, but when it appears, usually it's malaise and it's body ache, nausea, and the most important symptom is hydrophobia, which is very essential, and but it is very fatal when the symptom of hydrophobia appears.
Okay, sir. And also just want to know that what are the advantages of 3-dose anti-rabies vaccine, sir? You already told in the brief. Just if you
Which vaccine?
rabies vaccine, 3-dose anti-rabies vaccine. What are the benefits, sir? Advantages or benefits?
Number of benefits are one. As I told you this in this number of it's not inferior to Rabipur, and second is the number of side effects are less, and the third is number of pricks are less, number of visits are less, so that patient can cover the dose earlier, and the seroprotection is almost as good as the reference vaccine.
Okay, sir. Very good. Thank you. Thank you very much, sir. So we truly appreciate your efforts. Last but not the least, we would like to inform you that Ravis has won 2 prestigious awards: Innovation Category ET India Pharma Award and Golden Globe Tiger Award. Thank you very much, doctor. Thank you for your all who are listeners. Thank you very much for your patience. Thank you, sir.
Thank you everybody for listening to me, and thank you. Thank you.
Thank you, sir.